Welcome to Comcast Newsmakers. I'm Elena Russo. The changes that healthcare legislation brings to the way we live continues to be a topic of discussion. Please welcome Michael Franklin, who is the president and CEO of the Atlantic General Hospital, who's here to tell us how it's affecting his community. Michael, thank you very much for coming in.
Certainly, thank you.
So what have you seen thus far and how the changes have been affecting, what you do at the hospital and how it's affecting the people you work with?
There have been two big changes really that have happened recently associated with it. One is the expansion of Medicaid that was passed along to the states to figure out what to do with. And in our state, that expansion of enrollment rules has allowed the state to expand its Medicaid recipients by about doubling it over the last 3 years. So that's created a lot of financial burden on the state to cover those healthcare costs for those additional enrolled people. And so,
what would you recommend to people who rely on Medicaid? What do they do?
Well, the Medicaid part of it's tough because it was a policy decision to make that happen, and we get some federal dollars to offset that at the state level, so they don't want to take away any enrollees because they lose some matching funds, but it was not accommodated in the budget. So it's increasing the budget deficit for the state. So the state is trying to assess that money back, bring that money back through the hospitals, which will possibly eventually get into everybody's healthcare insurance premiums.
Now this must have some sort of effect on your relationship with the patients.
Right. It's hard to get the patients. One, we still have a difficulty of an undersupply of physicians. So even though there may be more people seeking medical care, there are still the same number of people to serve them. And with the rates that Medicaid is paying physicians going down, it's hard for patients to get in to see physicians. So that they continue to rely on the hospital for emergency room services and those types of things.
You mentioned insurance and changing people's plans. Do you have any advice on what people should do in terms of maybe looking at their plans a little differently?
A big problem that's happening right now is 60% of employers have switched or started including these high deductible health plans. So your first $1,000, $2,000, up to $5,000 may be out of pocket that you spend in that deductible amount. So that early in the year, particularly this time of year, when you come in, you see your physician, or you come in for an MRI or some kind of surgery, you will be paying the full price for those things, as opposed to having insurance pay and you only pay a proportion of that. So what's happening with these high deductible health plans that many people are getting now is that they're seeing the bill for the full service, and you're not seeing that 20% or what you're used to seeing in the past, and that's shocking a lot of people. And we're having the trouble of a lot of people thinking that's wrong and arguing with their insurance company, and we're stuck in the middle, so we're not receiving payments.
What do? You have an emergency situation where you have to pay for a particular procedure, and then you get this bill. Obviously we know who's responsible for it, but
right.
They can't pay for it. What do you do?
Well, that's again, we're planning, understanding your health benefits and planning in advance. Most of these have a health savings account associated with them. Fund those health savings accounts so that you have the ability, if somebody has an emergency appendicitis, well, between the surgery costs, the physician costs, and everything associated with that, that could be a $5,000 to $10,000 bill. And you need to be able to fund your portion of that because it's not planned.
Is there any impact on routine health exams?
In many plans, they will still fund a wellness visit or those types of things. But for screening, like colonoscopies, this is going to be a tough thing because a colonoscopy can cost $2,000 or $3,000 for everything associated with it. So to have a screening colonoscopy, it may cost you that. If you have a $5,000 deductible, you may be charged the $3,000 to have that colonoscopy. So the difference is payment up front in regular health insurance, or you're paying along. In this, you're paying up front.
Useful information. Thank you so much for coming in.
Certainly. Thank you.
You just heard from Michael Franklin, who is the president and CEO of the Atlantic General Hospital. For Comcast Newsmakers, I'm Elena Russo.